Hello everybody, welcome back to my Chinese medical massage lesson over here, also known as Tuina. Tuina literally means push, pull, push, grasp, and it's a discipline that doctors in acupuncture in China use to supplement and sometimes even reinforce the acupuncture treatments and herbal treatments on their patients. Tuina uses meridian therapy. In other words, it will address the meridians of the body. It will address certain acupressure points that are necessary for major gait adjustments, energy adjustments. What I'm going to do now is show you some basic strokes with which you can address the whole back and the whole posterior side of the body. In addition, I need to mention that Tuina can be done with clothes on. You do not necessarily have to ask the client to take their clothes off. Traditionally, it's done with clothes on, and the effects can be just the same and very deep. And this is something I need to emphasize, that Tuina, unlike, say, Swedish massage or any form of conventional massage which uses oils, is very deep, it's longer lasting, it really gets to the core of the problem. One of the things we have to do is to warm up the client. Right. When we warm up the client, we need to start in the center, in the sacroiliac area, the lumbar area, and we need to rock the client. Tuina is really very non-invasive. First, you find the ASIS, which is a little bit anterior and almost lateral, okay, on the hip. And then we're going to do a kind of a torque and a push or pull. By that I mean we're going to pull up and then push with the heel of the therapeutic hand. And this is the cephalad hand. As you see moving, I move up and down on the main meridian, which in my case would be the urinary bladder meridian. Parallel to the spine, away from the spine. And what happens is everything is done simultaneously. As I pull up the hip, I will push simultaneously away from the center, and then when I'm finished one side, I will smoothly change to the other side. Notice that my body posture here has to change as well. So what I'm doing is I'm moving the chi away from the center, bringing some space into the fascia, because the meridians will travel with the fascia, with the lines of resistance as well, and block the chi. Same time, of course, allow the blood to flow in. Pressure is done with a bit of weight. Usually your table should be a little bit lower than usual, so you can actually push through. Notice how my arm is straight. And notice how my hand goes into a kind of a claw. You can then translate this into more like the dragon's claw, which is another stroke, for a deeper effect. So this is what I want. I want this traction, and then I also want this pull. Okay, and it's done in a dynamic fashion. In other words, you're not going to obsess about a certain sore area. The client's going to say that's where it's sore, but you're just going to go over it again and again and again. It's accumulative, the effect. Here I can just change over and then kind of grasp in the na. The na is the tuina. The na is the grasping, and that kind of style, kind of knead and grasp that whole area over here. We need to get that traction. That's important. And now, right, let me move on to the next stroke. I'm going to go to the head of the table. I've done both sides. Okay, you need to do both sides with the push-pull technique, the torque technique. Now I'm going to go to the head of the table. Concentrate again on the center. Lean my forearms forward, all right? When I say lean my forearms forward, I mean contact with the ulnar side, and then slowly roll outwards. And this is sort of an open hand, fluttering butterfly stroke. If you do it sufficiently quick enough, it's almost like the wings of a butterfly. The effect is one of liberating chi, getting the blood to flow in. So you're moving the forearm, the hand stays loose, but there's full contact, loosely curved, even away from the spine. And this is where you linger. Once you've gone over the scapula, you slow down, and just lean in. And this addresses the triceps, posterior deltoids, teres minor, and major muscles as well. A variation of this, concentrating on the fascia, is opening lotus blossom. You have your hand like this, okay, open-handed, fingertips touching. As they touch in sequence all the way to the index finger, the hand makes contact, the ulnar side makes contact with the fascia along the spine, and the pressure on the fingertips pushes both hands out. It's almost like a blossoming, or should I say a flower that might be closing. So ulnar side contact, I'm on the spine but not really on the spinal processes, and I'm just separating the fascia, still working on the urinary bladder meridian, either side, both sides here. And for pressure, I'll just use my weight. And so I'll go up and down, up and down, up and down. Okay, notice how straight my arms are. Body posture is important. Right over here, you might linger a little bit and just do it slowly. So it's almost like a myofascial release, but much quicker. Then how do we follow this up? Then we go back to the spine. So all the time I'm actually concentrating on the spine and the posterior side of the body. And the next one is a kind of like a T junction over here. So the therapeutic hand is perpendicular. This is my anchoring hand. I put it flat across the sacroiliac area, and I'll just push through. So it's not a myofascial release. This warms the spine. The hand is on the spine itself, but there's no danger. It's a very broad contact area. What I would suggest is you can also do it on the skin with a bit of tiger balm. You rub the tiger balm and you underneath here, okay, put it on the skin along the UB meridian and just push. Stand briskly, superficially, like 3 or 5 out of 10. Or and people who are a little bit, who are in pain, and you might want to consider not doing it so briskly. You might want to do a little bit of vibration here, rocking, very slowly, very soothing. Okay, then we come to the treatment of the whole back and then the legs. And the first stroke in that series is the actual na again, which means to grasp or to knead. You place your thumb around about C7. The fingers grasp around the upper trap, which is above the clavicle. You lean in and you pull back. Lean in and you pull back. Lean in and you pull back using your body weight. And it's a smooth rolling action. So the thumbs lock in, they don't really move. It's like you're trying to pull the tissue over your thumbs, okay? This is what happens. This is what you want to achieve. And you start immediately and going laterally. You can do that for about 5 times. Okay. Then the next variation is where you actually use the steepled hand, okay? The interlocking hand squeeze, double hand squeeze. This you can use, for example, on the triceps and on the gastrocnemius, for example, okay? For deeper work, so you steeple your hand and you grasp either end, both ends of the triceps, and just squeeze and just pull up. Squeeze and just pull up. Squeeze and just pull up. It would not be advisable to do the neck area unless the person has a very long neck area. You can do it sitting down. So in my workshops I usually show that as well. Person sitting down as in a chair or in chair massage. Let me show you how it's done on the gastrocnemius. This is great for people with plantar fasciitis as well. People who do a lot of walking. So there's full contact on both sides of the gastrocnemius or the plantar flexors. And for a little bit more penetration, you might want to also use some tiger balm. You can also hold it, and that can be for like 20 seconds. It gives you time to pause and think about your next stroke. So this is the na as in tuina. Right, once you know the different strokes, you can get creative. You can kind of cook your own menu like a good chef in a kitchen. You can use the heel vibration all along the urinary bladder meridian. And notice that I always use two hands. One hand is the therapeutic hand. The other hand, well, it's not doing much except just holding on, stabilizing. You know, it's a kind of bipolar yin-yang effect. You don't want the hand, this hand not to contact the client. So you can just vibrate a little bit, rock, and then push out as well. Again, I stick to one side and I will then complete that whole side before going to the other side. Which side you're going to choose depends whether it's a male or female patient. You're going to choose a yang or yin side. You're going to look at the client history. The client is your best textbook. Is there a lot of anger involved, chi stagnation, or is there more something to do with the fluids, the blood, any kind of organ disorder? Okay. Then you can add the dragon's claw again. So we saw the dragon's claw when we did some you know, the opening moves, the warming up moves like that. Now you can always go back to the dragon's claw and notice the traction. That's important without pinching. You can go up and down the body. You can also, you know, to add emphasis to the hips and that, you can do almost like a washerwoman, back and forth. Do that interlocking hand squeeze, depending on the size of the muscle, that area. Okay. Then you can bring it all together. And when I say bring it all together, start from here, go back here by using a very popular, as known as the open hand or fluttering butterfly. And if you look at the speed as well, okay, start slowly. For that, you must have your elbow crooked 90 degrees. The power comes from the shoulder, but really through the hip. So your body position is very essential, okay? You know, you're not going to bend down from the waist. You're not going to use shoulder power necessarily. It's really the weight that's important. So I'm going to stand over here and then slowly just come over like that. It's a full supination, a kind of half pronation. That's a nice roll. And the way to exercise this and have an image in your mind is to think of a roller pin. You know, here I'm starting a little bit away from me. And I can use my forearm. So I can use my forearm and then more individually, more focus the hand. So it lends itself to some variety. Okay, so this is important. Full contact on the ulnar side. The fingers stay slightly curved. Okay, weight pressure is done through your own weight. Okay, focus more. You can do it slowly at first, but the faster you do it, the more the chi will travel. And notice I will start from the top, work my way down, 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 because I want to take that yang chi away. A variation of that is a kind of a half roll. When I say a half roll, I now curve my fingers. And this is for small areas. It's very intense. Okay, the heel stays full contact. The knuckles have full contact, and this is what it looks like in slow motion. Okay, nicknamed the half sushi roll. Okay, it's also a Japanese ama stroke. So you can disperse the chi there. Again, I'm staying on one side, doing the more distal side, the side that's furthest away from me. And here, of course, you can go across, especially across the lats a little bit. So you kind of do some penetration, and then the forward motion of the hand will just push it through. So this is more for smaller areas where you have a lot of hypertonicity there, a little bit of muscle strain. And of course you don't obsess about an area, you just go over that. So you can vary that, okay. Then another stroke that is also very good, now becomes more deep penetrating, is using the thumb rocking. This is as close to acupuncture as Tuina gets, using the thumb to penetrate areas like the vertebral border of the scapula. So here I will kind of bracket that area, alright, stabilize it, hold it, and isolate it, and then I'll slowly, what I'll do is I'll slowly wiggle my thumb on the surface. The finger, the index finger, serves as a ledge to stabilize it. Okay, so I go perpendicularly straight in, and this is what I want to achieve. Okay, now when you do it for real, you go from side to side, and the idea is to stay stable on a fixed point and vibrate that point until the tenderness leaves. And this comes later in the treatment when the tissues are sufficiently warmed, the chi is dispersed and more abundantly freely flowing, the blood has now come to the surface, and that. Nails should ideally be fairly short. It's like I'm trying to dislodge something here. So it's from side to side, that's from going, going away from me, coming back to me. And you can kind of work a whole area like that. Alright, and then you might decide, okay, now I'm going to follow this up with some open hand fluttering butterfly. There's another variation where you use the thumb and the index finger. You go towards the neck, alright, and you grasp either side of the ropey ends of the upper trap. So it's under more or less in line with UB10. Okay, so let's see. Alright, so you go straight here. There's the natural hollows over here, and what you do is you go from side to side. The one hand of course stabilizes the head, so it's a firm grasp, and then you travel down by say half a centimeter, like a quarter of an inch, following the transverse processes. And you can do this along most of the spine. And this is like acupuncture on the individual, the urinary bladder points, which are also known as the back chute points. The back chute points energize the organs directly over which they are positioned. So I'm now going towards the liver and the spleen, for example. And so you can go right down again, followed up with some fluttering butterfly. Okay. Another stroke which is pretty penetrating is using your elbow. Okay. I usually hesitate about using the elbow, but sometimes the client, the size of the client, the size of the tissue will allow that. The tissue will be sufficiently warmed, and it's not really as painful as is often made out to be using the elbow. Here mapping the iliac crest, L4, L5. Here's the spine itself. Here's where I want to put my elbows. About 2 or 3 finger widths away from the actual spine. More or less on the paraspinal muscles. So you're actually above the bone, not on the bone. More or less 45-degree angle. And this is a superficial but still quite deeply penetrating stroke. So the hand flops from side to side, causing vibration. Again, there's almost like a thumb rock, but now it's an elbow rock. And then the other one is more like a piston. So the hand becomes the fist, the other hand is on top. The top hand guides and vibrates. And this is for deeper penetration. And then of course you can go back, to just the kind of hand wiping here, round heel This is a nice warm-up as well. So warm-ups can then follow after the actual therapeutic strokes to get more heat into the tissues as well. And of course you can now, since we know a little bit more, you can use the open hand fluttering butterfly, you see. So that's what I want. I want to open up this area over here. Right, for a low back pain, to continue with the rocking, you might also want to do this stroke where you open up the sacroiliac lumbar area. It's sort of called pushing out the sacroiliac area. Your fingers anchor around the 12th rib, the insertion, the attachment side of the QL muscle. Okay. Place your heel above the iliac crest, and then you push out towards the end of the table. So there's a rhythmic rocking. Notice what's happening simultaneously. My fingers grasp around the 12th rib, but they're not damaging, they're not pressing, there's no huge pressure there. They're just getting that traction, helping with the traction of the tissue. The other hand, the heel, goes onto the bone, above the bone, not on the bone itself, but above the bone to hook in. And that's what you want. You want to create some space so to get the chi freely flowing. And that's the nice non-invasive rocking, nothing violent. You can go, from one side to the next, and I'll show you can also go on this side. So you can, instead of just staying posterior, you can go more laterally and affect the obliques and just hold it there. And hey, I can do a little bit of heel vibration rocking. So all these strokes can smoothly kind of dovetail into each other, and they can all complement one another, and just reinforcing the whole overall treatment. Okay, alright, this will conclude my section on the back and the posterior side of the client, and I've used about 10 different strokes and combinations. Once you know how to, if you're confident enough to use it, you can say cook your own menu. Hand or fluttering butterfly, you actually can use it on many parts of the body, and as I said, on large tissue, especially the upper trap. If you're using it on the back, the whole back, basically it's full supination, half pronation. There's full contact on the ulnar side. The fingers stay slightly curled so they don't slap against the face of the client. The posture, the position of the therapist is very important. You lean in with your weight, alright? It's like almost like a pressure bar. This must be at right angles to the tissue you're going to work with. And then you just roll in. And it's like you're going against the flow of the chi. You're not backing it up, you're actually dispersing it. And of course now, since you have the back and you have a stool, you have a more three-dimensional approach. Now I can go a little bit more posterior. See, I can curve over the upper traps, over the supraspinatus into the rhomboids a little bit. And I can change my position. This hand always stays with the client. There's always one hand to stabilize, to guide in a way. And it's a good bipolar effect. So I can go right down the rhomboids, into the lats. Okay, if you can just tilt forward. So the client can tilt forward a little bit. And you can take it all the way down to the lumbar area. Good. Another move which is very good, now I'm going to take my client around a little bit, is I'm going to use the interlocking hand squeeze, especially on the shoulder. So my one hand is on the posterior side by the posterior deltoid into the infraspinatus. The other one curves around the anterior deltoid, and you squeeze from both sides and you just hold it. And again, this is for the more bulky muscles. You practically use a lot of your body really in Tuina, using your fingers, thumbs, hand, arms, and the whole body gets involved. You yourself get a good treatment. It goes with interchange of chi. And of course you can kind of lift it up a little bit. And you know, of course you also can use it on the skin itself without any clothing on. So this is a good way to introduce massage therapy as such, bodywork as such, in an office setting where people don't want to disrobe, or they don't just want to take the clothes off at all, period. And of course over here you can use the half sushi roll. Another method for this is the plucking. What you do here is you place your thumb squarely on the meridian, okay, and it kind of locks in. Take the heel of your hand and just go over that. In other words, when I say go over that, it kind of almost falls over that. It kind of grasps and you push, and you just flick over. The fingers brace the actual hand. So what you're doing is you're using this side, okay, to go over the thumb, kind of flicking over the thumb. Let's start from the near the acromion on the supraspinatus all the way to C7. So I've now got an actual pressure point over here, and I'm just going to just kind of flick. And I'm going to ask my client, how does that feel? Is that irritating or?
It's good.
You know. And the pressure should be like 3 or 4 out of 10. Remember, it's the repetition which causes the accumulation of abundant chi. You want to disperse that chi. See, that's what you do. You angle it a little bit, you know, and then follow it up with the fluttering butterfly. And then you can use a more traditional acupressure method. Notice that I'm using 2 thumb technique over here. So one thumb on another thumb. And then if I want to diffuse this area of pain, I'll go counterclockwise. Counterclockwise from where I am standing. So if there's a clock on the wall, I'm going to go this way from where I'm standing. And it's almost like a corkscrew. The pressure should be very light. Shouldn't force the release of that point. And so you kind of travel up. You stay for about 10-20 seconds until there's a release. How do you know that? You ask the client. Is it feeling less tender? And you know there could be some heat involved, and then you stay stationary and imagine that thumb going into that tsubo, that acupressure point, and it's like filling that vase, that container, as I explained before, with chi coming from the ground up, and I feel like I'm melting over there, and you just follow that up with circular motion staying directly on that point. And so you work your way up this very important gallbladder meridian, this yang meridian, which is the cause of so much superficial myofascial pain. Alright. Now you might wonder what I'm doing here, applying the tiger balm. I'm applying it on the urinary bladder meridian, and I'm just going to go in a circular fashion, tonification. I'm using 2 finger round rubbing, going down the heel a little bit of tiger balm. That's the first stage. You want to reinforce, you want to strengthen the treatment and make it last longer. Alright, that's at the last stage. You've now done all the other strokes. Okay, and the next stage is, this really only works with tiger balm. It's kind of modern Mark Sebastian. They're using a chi disperser, also known as a hairdryer, and you're going to blow along the meridian, lengthwise along the meridian, as if you're pushing that chi out away from the knee, over the gastro, making it move. So there's plenty of tiger balm there. It's like moist heat, but much more effective because the tiger balm contains camphor, menthol, and other herbs that actually concentrate and disperse the chi along specific meridians. Set this on high. Just blow it. Now, the distance should be such that when you feel on top of your hand, it should be comfortably hot but not excessively hot. Okay, so at least like 3 to 4 inches should be sufficient. Again, it's the cumulative effect that you want. You don't want to create an instantaneous healing effect. So blow. And you should do it for a minimum of 5 minutes, and every now and then, you can also, of course, then reinforce that. One method just complements the other one with some light half sushi roll, just to get the chi down there. Okay, and then maybe round finger rubbing, 2 or 3 finger pads going down. Here I'm going clockwise. You can go whatever the client dictates in terms of the condition. The client is your best textbook, so you need to just be aware of your objective, that it's in harmony with the intention, the whole overall healing effect. And see, the dispersing effect is fairly deep, so it's not like you're brushing. No, you're actually moving stuff. There, you're getting some traction, warming the fascia and that. Okay. Good, and then of course you go up again with the dynamic duo, just to really get the depth penetration, plantar flexion with some acupressure, and you can kind of just also go a little bit away from the UB meridian and just separate the attachment from the tibia, from the bone, and just push it in a little bit. And of course here, what I did before was show you on a sagittal plane, up and down, but of course we can now turn it a little bit and just kind of just rub across that. Okay, and it also feels good because we don't just move up and down, our foot is able to move in different planes. And then you can use the like a finger squeeze over here. So between between middle finger and index finger rather, and kind of grasp that and just move along the meridian a little bit. So you can hold it and then just go down a little bit, like that, you see, and that loosens that area up as well. Okay, that's all for now. Another stroke for loosening the hip, for hip pain, is using the interlocking double hand squeeze. Wrap it around the hip and just pull towards you. So you hook it around the iliac crest above the bone all the way through here. Okay, and you just pull towards you and then do a little bit of rocking. Now of course, since we know a little bit more now, we can then use the one to open up the sacroiliac area like that, complementing the previous stroke, and just using my fingers as an anchor, these fingers here as an anchor, work my way around the iliac crest, and then of course follow it up with the fluttering butterfly, the heel vibration. You can do it slow, over the bone, around the bone. So try and get some traction so that this is what it looks like. So it doesn't flip-flop all over. A little bit of anchoring over here. And then of course you can use the round finger, 2-finger, round finger rubbing. That also helps. You can use the heel vibration all along the side. You can then of course follow it up on those 3 points on the hip. Double finger, double thumb, compress. You focus better that way. Saves your thumbs as well, gives your thumb a nice squeeze. So it's a liberal contact over here, not over here, not over here, but right on top, squarely on top. You can hold it, and from where you are, you can go then counterclockwise. So imagine there's a clock over there, you're going this way, counterclockwise. Even through clothing, it's pretty effective. And if you're very much just kind of a hands-on skin contact person, nothing will stop you from working on the hip itself. The skin has skin contact even through thin underwear. Just have the sufficient draping. I usually ask my clients just to bring shorts, sports shorts, spandex shorts. And now you're going a little bit deeper, and of course nothing will stop you eventually using the thumb technique over here. So you're going, kind of flip-flopping the thumb. And the pressure is 2 or 3 out of 10. You want the thumb to stay stationary on a spot. And it must move on that spot. It must be anchoring on that spot. That's what you want to do. You can do it slowly and then work up some speed. So it's not like you're digging things out, or it's the vibration, the energy that does the penetration. So this is thumb rocking. And then round rubbing. You vary the strokes. You use any amount of strokes. You vary the depth according to what the client needs and is able to take. You don't try and force as instantaneous healing. And of course the dragon's claw, threaded by all the trigger points. You get a nice grasp over here on the right on the glutes over here, posterior, tensor fascia lata. Get quite nice traction over here. And again, to conclude, just warm up again and create quite a lot of heat. Okay, I think it's ready to start. Right, today we're going to show how to do stomach massage, Tuina style, Chinese medical massage. And what we have here is I have my hand, my superior hand on the stomach. The patient has a complaint, stomach complaint, it doesn't matter what the complaint is. And I have my other hand already showing you where to find stomach 36 or the 3 mile point. 4 finger widths, the patient's finger width, and then over here, alright? And if the patient flinches, is sore, then obviously you have the right point. We're looking at the size of a quarter. That is the dimension of the influence here. So you have one thumb over there. Once you've identified it, again, eye of the patella, where the little finger is, go there and place your thumb there, and the other hand will then be on the area that's tender. It can be in the middle, it can be a little bit to the left or to the right, wherever the condition is. Then we're going to move in, we do some hara massage. It's typically like petrissage. Now we did a distal movement just now. One hand on the stomach, one hand on stomach 36. As soon as the sensitivity decreases, then you can go in and do your hara massage several times. And that could be like 2 to 5 minutes. The patient's feet, the knees are up, so as to relax the muscles. Then you're going to go and do compressions. So interlocking fingers, double hand squeeze from both ends. And pressure is light to medium. This is good for people on a diet to move the fascia. Women with PMS, gassiness and that. Do that several times. Make sure your body posture is such that you're close to the table. Then you're going to pick up the fascia, skin and stomach, and it's basically you shake, you pick up and shake, so no pinching. If here it's going to be difficult, so I'm not going to drag up too much, but I'm still able to get a good connection here, but I don't have to lift too much. And you shake from side to side. It breaks up the fascia, the stagnation a little bit. So you go systematically, okay, and start again over here. And so you carry on. And then you're going to address over here, going down for acid regurgitation. Oh, good. So you lock down under the xiphoid process, slide your thumb down, lock down over here into the navel. Okay, always going towards the kidneys that then get rid of the bad food essence, the waste products as well. Between the navel and xiphoid process is the master point of the stomach. Here you can rotate counterclockwise from where you are standing. So there's 12, there's 6, there's 3, there's 9. Often you feel some hardness, hard tonus, fibrosis there. Sometimes feels like a button, can be very tender. Pressure should be 1 to 2 out of 10. Remember, it's an energy modality. And then you go lateral to the navel, and there's basically 2 thumb widths or 2 cun, C-U-N, to the side, and then address those points again. Here it goes to be addressing all kinds of digestive problems, constipation, diarrhea, even ulcers, bloatedness, stomach pain. Make sure you can also address stomach 43 by the foot. And then for low energy, you need to use a spleen pump. Go underneath the rib cage over here, place your hand here, and then you just press down. So you lift up underneath, place your hand here, and then you kind of lift and pump several times. So overall, besides addressing digestive problems, you are giving the patient new energy. And this is a great way to conclude your Tuina treatment, so that the patient will always come back because they know that they're getting a constitutional treatment as well. This is good, of course, for the blood flow. The spleen converts food and drink into food essence and energy for the rest of the organs. So again, a nice hold over here. Make sure you're close to the table. Press underneath, and it's like a pump. That's what you're doing, a pump, a basic pump. After you've done it several times, 2 minutes, you then go and do your fluttering butterfly. So that's what it looks like, okay, in slow motion. So you roll up in, roll up in, roll up in, roll up in below the navel. Roll up in, roll up in, roll up in below the navel. And then of course you can go back to the other strokes. First go through the series of strokes that I've just explained several times, and then you go and start at the beginning again. Treatment like this could be 5 minutes, it could be 10 to 15 minutes. You can easily spend 20 minutes going, initially you might want to do 5 minutes, the next week you want to do 10 minutes, depending on the sensitivity, the condition of the stomach. So it's fairly vigorous. It looks deep, but that's because of the tissue. And your final stroke should be just Qigong massage, where you start around the navel, small circles over here. Here's of course where you put in oil. Peppermint, for example, is a great one. Make sure it has a bit of carrier oil with it so it doesn't burn. Even lavender is good for the stomach. Lavender, peppermint, and say fennel, marjoram. Dill is another one, D-I-L-L, dill. Great for diabetics. And so you massage it in around the navel. And then your circumference spreads, it widens. Goes under the diaphragm, under the navel, and the pressure is light. The following week you do deeper pressure, slower movements. That's the next week, and depending on what the client can sustain. And you teach the client this particular massage, where you circle around, first starting at the navel and then going wider and wider and wider as you cover the whole stomach and get the whole digestive process going. And this alone can be 5 minutes, and then maybe even 10 minutes. With the oils you get a very long lasting effect. Good.